The CDC's Advisory Committee on Immunization Practices, ACIP, recommended Friday that vaccinations with the Johnson & Johnson COVID-19 vaccine should be resumed for all U.S. adults over the age of 18. When you look at the individual risk for all groups, the benefits clearly outweigh the risks, though there are differences in age groups, particularly in women less than 50 years of age, said ACIP committee member Katherine Poehling. The vote to resume comes after a 10-day pause on the Johnson & Johnson vaccine that was recommended by the FDA and CDC after reports of rare blood clots began to surface in mid-April. The vaccine committee first reviewed reports of blood clots associated with the Johnson & Johnson vaccine on April 14, and decided that at that time there was not yet enough information to recommend whether to resume using the vaccine. The rare type of blood clots seen in connection with the Johnson & Johnson vaccine are similar to blood clots that have been linked to the AstraZeneca vaccine in Europe. Earlier this week, the European Medicines Agency decided that the Johnson & Johnson vaccine should be available to all adults in the EU, albeit with a safety warning. The debate over whether to pause the vaccine in the US has quickly become an issue of vaccine equity, given that Johnson & Johnson vaccine is being used in vulnerable populations, including the homeless and homebound. The single-shot vaccine is also being heavily relied on by lower-income countries, many of which lack the infrastructure to use mRNA COVID-19 vaccines. 1 in 3. That's how many U.S. adults are already fully vaccinated against COVID-19. More than 50% of American adults have gotten at least one dose of a COVID-19 vaccine. Though vaccinations with the Johnson & Johnson vaccine will now resume, the vaccine may not be available to everyone who wants one. Contamination issues at a facility in Baltimore last month led to 15 million doses of the vaccine being discarded and a lower than expected number of doses delivered across the country. However, government officials have said that there are 9 million doses ready to distribute as soon as the pause is lifted. How the Johnson & Johnson vaccine pause might slow down the global COVID-19 response. Here's what scientists know about COVID-19 vaccine blood clots, and how the risks can be diminished. Full coverage and live updates on the coronavirus.